Regional Wastewater in session. Penny, will you call the roll, please?
Present.
Ray,
Present.
Josh,
Present.
Joe. Here. Bill,
Here.
Brenda. Here.
All right. First item on the agenda is the minutes of September 3, 2025. Everybody get a chance to read them?
Make a motion to accept minutes original. Second.
I've got a first and a second. Any additions, deletions? Seeing none, all in favor say aye. Aye. Opposed? Approved. Mr. Pete, Treasurer's Report, please.
Claims from August 30th, 2025 through September 25th, 2025 totaling $184,884.74. Account balances as of September 25th, 2025. You guys will find this hard to believe. We have a cash operating balance of $420,000. Improvement fund balance $2,739,952.27. We did receive the Daleville tip transfer of $9,411. There was the Indiana Bond Bank transfer of $18,663. We are currently sitting on the 5 CDs with the most upcoming one due 11/02. Is that correct?
Mm-hmm.
Yep.
All of those are at $300,000. And so I would make the motion that we approve the bills for $184,884.74.
Second.
We got a first and a second. Any discussion? Seeing none, all in favor say aye.
Aye.
Opposed? Approved. Moving on. Oh, no old business, new business. Jason.
We had it was time for health insurance renewal. I thought we were going to have more time. Thompson Group was going to reach out to IU Health, get us a 30-day rollover. IU Health came back and denied that. So for the last month, we've been chasing our tails, getting a couple different outfits in to come and quote us on the employees' health insurance and also the vision and dental. Thompson Group came by, and I sent this all out to you guys through an email and kind of gave you the gist of what we were looking at. We had IU Health was no longer being an option getting bought out by by Anthem. Anthem's renewals came in, depending on what we looked at, anywhere from a 30% increase upwards of a 35% increase to stay around that same employee deduction that we were looking at. And even with that, deductible. And even with that deductible, if we went up to the one that had different options, the co-pays, and we were still looking at a higher deductible, even with the max out of pocket almost doubling. So we got in contact with a representative from Clark Insurance Group, and they're a specialty of looking at small business options for us. So what they presented to us were an insurance provider called Sana with it comes in at a $7,500 individual deductible, and we then Clark Insurance Group buys that deductible down and services it in-house. There becomes an extra step for the employees, like whenever we get an EOB, send those EOBs off to Clark Insurance, and they operate it as a $2,500 deductible. Then after that $2,500 is met, we 100% reimbursement for the employees.
Till 32.
There's a co-insurance of 20% till 32.50, but then we'll start seeing reimbursements directly to the employees once that deductible's met. So this actually came in at a lower premium after paying Sana their premium and SIG their service rate. It's still a lower premium that we were paying in 2023, 2024. So we kind of passed it around with the board, and my recommendation was to move forward with Sana and SIG for the health insurance side of it. Then as far as dental vision went, Penny has it down here as KFC, but it's Kansas City Life.
I must have been.
Yeah, they're our current provider through North Point, and that's someone we've been with for probably the last 3 renewals. Fantastic rates. we saw it was a 3% increase on the dental side of it, which really equates to $10 on the monthly premium. So no rate increase on the vision at all. So my recommendation was moving forward with the Sana and Sig and staying with the KFC for vision and dental.
Some chicken nuggets every now and then.
Yeah, get
I'll
some.
never live that down.
So with the health insurance, are they pooling you with a larger group? Is that what
Yes.
they're doing? Is pulling?
This
Okay.
this is if I looked into this for Delville, we didn't go because it's new and it kind of some people had some questions, but I did a lot of research. Jason did some research on it too. This is an HRA. This is almost like a little bit of financing, partly on our own, partly on that. The insurance premium they're collecting from us, they're buying it down and then managing the excess above that deductible. They're paying directly from SIG.
Yeah.
So it's almost like a little bit of self-insured with a umbrella of actual insurance. You're kind of living in both worlds. So it goes up and down. It's
So the employees carry a health insurance card from Sana, $7,500 deductible.
Okay.
Then we get a insurance card from SIG that shows a $2,500 deductible individual and the rates and so on family and max out of pocket of $3,800. We'll take our Sana card to IU Health or whatever provider we choose. They're gonna run it through Sana. We're gonna get an EOB, and very first thing we do when we do is get those EOBs. We send them off to SIG, and they monitor that account like it's $2,500 deductible. Anything that the difference is instead of sending the difference to Sana, they're gonna directly cut that check to the employee to make that difference in payment. So
it comes up
there's
to
an
the
extra step there, but the cost savings was definitely there.
There's one extra step. I want to make sure it's clear. The employee has to send that EOB over to SIG because that payment will come directly either by that Friday. Once you send it in that Friday, they will either get a check if that's how they prefer by paper or ACH to their account. Now it is the employee's responsibility to pay the hospital. It comes to the employee. It doesn't go to the hospital. That's the difference because it's self-insured. That's the self-insured side of it. First, the insurance side and take care of that. Then anything to the 2,500 would go to the employee. Now the employee's got a responsibility. You want to carry this and do payment, but you've been given the money to satisfy that debt.
Interesting.
So the employee has to be partially involved in this.
And is there a network? Like, are you in
Yes.
the IU Health Network?
No.
Are you in the? Is there?
So I reached out to. He said IU Health Network's not going to be an issue. Community's not going to be an issue.
Sure.
So he gave me a handful of customers that they currently are in a team with: Arrowhead Plastics, G&G Oil, Muncie Housing Authority, Sam Pierce Chevrolet, Parsons. I mean, just a list of them. So I went ahead and called HR departments, talked to them, seen have any of your employees had any issues getting service inside Delaware County. How's the customer service side of SIG been? And I had no complaints at all. Everybody raved that. I've not had one customer come back and one employee come back and saying, I can't get access at IU Health. They're within CIO.
What happens though if you're down in Florida and you break your arm and you have to
They're
go?
a nationwide network. So that is the
It's
other
nationwide.
upside of us not having that IU Health network.
Right.
They
You
originally
can go
started
anywhere.
out down
Essentially,
south.
it doesn't matter. The hospital doesn't matter.
Yeah.
Cool.
Hospital
And-
doesn't
Good.
matter.
The SIG rep that we got, her name's Tina. They went as far to say that they've had handfuls of times where a small doctor's office, a surgeon's office might not be in network. They will work directly with them to pull them into network. So
Good.
Everyone we spoke to just was raved about it.
Good.
Yeah.
Great.
We did, like I said, we did investigate. I haven't had one negative complaint either I did the same research, not the same ones he did.
Yeah.
Because like I said, I was trying, we got hit hard, like we did here, 30-some% increase. Like, no, we got to find another avenue.
Yeah.
So I think this is a way to save some costs. And we're taking on they are taking on part of the risk. They're gambling on us. That's not our loss, that's theirs. We won't see at the end of the year, hey, it went over, you owe us. No, it's in the premium. This is what you got. They'll give a book out in October or July like next year, and we'll start this all over again next year.
Yeah. The Arrowhead Plastics, when I talked to, they said they've actually been with the sauna side of it for multiple years now, and she says other than continuously explaining to the a handful of employees that you're going to meet that first 2,500, it's going to be on you. Then other than that, she goes the service side of it, the getting that check cut within 3 to 4 days has been on point.
Interesting. Good.
What kind of increases have they seen, those companies? I know you and I spoke about this, and I was totally for what you were doing and all. Like those other companies, every year, what kind of increases have they been seeing?
The
Premiums
from Sauna or from like
from Sana?
United or anything?
No, Sana. I mean, the one that you're going to go with this year.
I didn't get that information from them.
I
I was looking at 33%, or
Yeah.
United was
To
double
answer your question.
the price, and what was the other one? The one that was it was
that crazy one?
it was a four
Better not say the name of it.
it was a 400% increase on the current premiums.
I
Yeah,
can't remember what
About
it
every
was.
To
8
back that
years.
up, Joe,
Yeah.
I didn't do it for here, but for there, we did it because we had two different brokers come in and explain. Sana and SIG has not seen any more than a 4 to 8% increase from year to year.
That's good.
They've been able to control for the last 3 or 4 years, no more than a 7 to 8% increase going forward. There's no guarantee. That's what the track record is for the last 3 or 4 years, was 7 or 4 to 8%.
he said they got their feet wet in Illinois and Ohio, and the last 3 to 5 years have really made Indiana a point, and that's why they're being really competitive with their rates here. And
They're bigger down in the southern part of Indiana, and now it's coming north. It's stretching north now.
And I don't necessarily know if it's the cost savings comes with the SIG option.
Yep.
When you kind of broke down the $7,500 deductible and what that looked like with, it was still cheaper than an Anthem plan, and but the savings comes when we pay that additional and get it down to a $2,500 deductible. Or
Did they give you a
$3,800.
total breakdown between Anthem and SIG?
Yeah.
I mean, like ours there in the town I represent was like, it was like 11,500 per month, but it was 10,000 to Santa and 1,500 something to SIG. It for their side of it, for taking on they're managing your employee accounts, what they're doing. So they're getting a management fee is what they're doing, and gambling on that
Yeah,
management fee.
They're a
for 12 months.
third-party administrator.
Exactly,
basically
exactly. That's
they
what
are.
an HRA is,
Yeah.
third-party administrator.
Yeah.
So, I've seen no, I'm in on
Yeah,
it.
I mean, we've kind of all blessed it. Do we need the official
We
motion?
need,
Is that
we
what
need, we need it on both.
so-
We need it on the insurance and on the dental.
So moved for both.
Second.
I have a first and a second on both. Is there any further discussion, questions? Seeing none, all in favor say aye.
Aye.
Oppose? Both are approved.
Kind of go hand in hand with that. I before I move on to the pay apps, I did send you guys out some liability insurance numbers for the coming year.
It's not on the agenda.
It isn't, because no one understands that the agenda is important. Penny does, I do, and you guys do, but the insurance providers do not. So last
Well, then I say
year,
we don't pay them.
well, we're gonna
We
find
may need
ourselves
them
in
to
a
pay
pickle.
us. Hang
Yeah,
on
that's
here.
true.
So we went out last year, renewed. We left Thompson Group for all of our liability for all the lift stations.
Seems to be a theme, Jason.
Yes.
Sorry, should I stop interrupting you?
Workman's comp,
Yes.
auto, and all that. We actually, Penny did a great job last year working with the guy from Grundy to get us into renewal options, where last year we saved roughly over 30% of what we were currently paying for all of our liability insurance. We got our renewal coming up, and last year's cost was $34,091, and they came in at an overall price increase of 8% to take us to $37,747. That is a combination of a lot of things that I kind of mentioned in that email. We had to update some schedules on the lift stations. We had 2 new generators. We had the extension on Overlook Drive, and so there was a lot that went into that small increase. I spoke with one outfit. and he pretty much said, "You're wasting my time and yours if you think I'm going to beat that." And I got a call into another one. I personally think we're still substantially under where we were at the 23 renewal rate. I think it's wise for us to go ahead and proceed forward with Grundy and get that taken care of as well. But I'm here for your guys' recommendations.
What was the total premium or price
37,747, and that's up from 34,091.
for the year?
8%.
8% increase.
That's
For the
your
year.
recommendation?
Yes.
I'll make the motion that we follow up Jason's recommendation.
Second.
You got a first and a second. Any further discussion, questions? Seeing none, all in favor, say aye.
Aye.
Oppose? Approved.
I don't know how Mr. Thompson's gonna be able to keep his mini buck. You keep getting rid of his services. I see you smiling, Danielle.
I left him too.
Next thing we have are Brackney pay apps for Rorton area improvements project. The first one is for $37,059.17. That's getting everything buttoned up on the punch list and checking all those boxes that we've talked about in the last couple of meetings. Then the next one is for $206,129.24, and that's their last retainage. So this pretty much closes out on their side for Brackney. I'm pleased with where we're at and getting that project done.
So this pays everything.
This
This
pa-
is every.
Yeah.
They're done.
We'll probably
Okay.
yeah we'll probably expect. I kind of talked to Rob, probably an invoice for the stuff that's took place this month on, but we're sitting at still $123,199 in that bond. So we're not going to spend that. So either I'm going to come to you guys with recommendations, or we'll be
Giving it back so that we don't have
We're
to
looking-
pay on it.
I asked for two things. One, what is it out there that we need, if there's anything that is needed, so that the board can have a full description of where we're at, or whether they want to put it back towards the bond payment. He'll have that for us in our next meeting.
I'll make the motion that we pay both payouts.
second.
First and second, any discussion? Questions? Seeing none, all in favor, say aye.
Aye.
Oppose? Approved.
All right.
It's not SRF.
I know,
Sitting on 2.7 million.
you're good.
You're good?
You have flexibility on what you can do.
I know.
Pete, you get one vote. We'll have everything in front of you next month.
I know. just killing me, you guys.
I've already heard no trucks.
Yeah.
No trucks.
No truck.
We have
We're definitely not gonna put those on a 20-year payment plan.
No.
I will
Next,
stomp up and down.
we have 3 Commonwealth invoices, Rorton sewer improvements for $4,349.91 as needed, and ties that's part of our monthly meetings, and also some part of that's CAMAC. Then we have the CAMAC sewer inspection. The first one was for $5,299.88, and the other one's for $19,135.80.
Seems awful expensive.
Well, that's so we'll have. PPI has completed that project, except for a couple internal sills and some manholes. That project inlining is all complete. Taps are completed. I'm sorry, laterals.
I make the motion to pay all 3 Commonwealth. Yes.
Second.
And I retract my previous statement.
First and second, any questions? Discussion? Anybody got any duct tape?
Probably do.
All in favor, say aye.
Aye.
Oppose? Motion approved. Jason, you're still rolling.
Collections update. Last month we were
I know.
at 2,429.02. Today, we were at 4,731.45 of the entire collection area. Today's the first day the guys have put letters on the door, starts calling locates. That's completely normal for the period that we're in with the collections. Collections are growing great. I get updated on We got a new pump installed that was approved a couple months ago over in the Delaware area. We went out and was working with the county doing some locates for over off of Schaefer Road for a new bridge project that's going on. It's set to take place here in the next couple of years. Doing a preliminary utilities check on that. After going out yesterday, we're pretty sure there's not going to be conflicts. No need for any relocation. Other than that, that's all I got.
Okay. Anybody got any questions for Jason?
No.
Okay, moving on. Danielle?
The only thing I really have is we are trying to still set a meeting with MSD representatives. We're trying to work around Jennifer's schedule as well as, I think probably a total of like 15 people, so it's not easy. So I sent some new dates off to Mara based on Jennifer's response to our message, and hopefully we get something set by the end of the month.
What do their books show that they're collecting from us that they just did their budget? If they approve their budget for next year, what are they showing that they anticipate they're getting from us? Be holding off for so long settling like this.
I guarantee you, is at the second proposed rate.
I mean, because their budget passed, so.
Yeah.
Take a question. So we're just waiting.
I'm just curious of what, line item they have that they anticipate getting from us when we can't get to the table on this.
I've got some thoughts on that. I'll share with the committee as soon as we get to the table. We need to get to the table, but I think we have some place. I'll talk to you a little bit more after this.
Okay.
I think we need to get the meeting set first. I think that needs to be the first thing we do. We've got to get back to the table, plain and simple.
Yeah, because there's not that many of us that have to be at the table.
No, we know the
This
players at the
delay.
table, and it's just like, this is on them. This is not, the delay's not on us. I don't see it being. Okay, anything else, Danielle?
No, I'll get that. I can find that information out and get that to the committee.
Okay. Spotted Monkey is not here today. I know she has been in the hospital and some things, and Aaron is out of town, so I don't think there's any issues. I think you all might have seen the new drop came in last meeting, everything on there. I went through it. I didn't see any issues or anything. Is there anything that I can reach out to and touch base with them if need to be addressed?
Yeah, I got to do video from them today.
Okay, I was gonna say, everything seems to be going and rolling. She's just a little tied down right now. Hopefully we'll see her back here soon. No committee reports?
Yeah, we met with the superintendent and of Westdale yesterday. I don't know what you guys struggled with. I mean, quite honestly,
You did not have the same.
might have been one of the easiest meetings I'd ever attended in my
It's
life.
a different superintendent than we've been dealing
I
with.
can't believe it was this difficult, Brenda. I'm just going to be bluntly honest. So,
It's gonna make-
and honestly, I know that. So just
St. Pete went to the meeting and got them all straightened out. And
you
now
guys
we
will
might
miss
go
me one of
before.
these days. That's just what I'm
No,
gonna say.
right.
No, it was a great meeting. Report back from that standpoint. Andy, the new superintendent, is going to speak with their board, but it sounds like they do want to move forward. They've committed to putting some dollars forward, so they're gonna they've got a general obligation bond that they're working on. They're gonna ask Rob to work a little bit with the SRF committee to update the PER in April. Am I saying that right, Rob?
We're gonna resubmit.
Yeah.
I don't know that there's gonna be a need to update it.
Okay, not update the PER. Yeah.
Because from a cost standpoint, there were some costs baked into there that will fall off because of some work they're doing on the front end.
Yeah.
So
We should
My
be
thought is
pretty
we
close.
resubmit
We should be
it.
pretty close
Yeah.
with what they've got awarded already.
So
Or what they're already doing.
What-
That takes it off of it. We can reduce. We should be back in line.
yeah. So
we may have to do another public hearing.
yeah, but the good news is it looks like they're gonna ask us to take the lead as far as running the pipe, and then they're gonna ask Gaston, obviously, to receive the flow. They're gonna take care of the decommissioning. Well, no, we'll take care of the
Yeah,
decommissioning as part of the project.
It's a part of the cost.
Yeah, part of the cost, and they'll take care of the I&I on the
Their
grounds.
property. They're currently doing that. it- I- My takeaway is, we're gonna take the same approach next spring, okay?
Yeah.
We'll put the application in, it can be switched over to them as the grantee or whoever's gonna take on the bond before closing.
Yeah.
But for purposes of this exercise, we'll continue down the same path that we did this year.
Yeah.
The only difference being, we can now show the SRF that they're willing to commit X amount of dollars,
Correct.
okay? And that should help their score.
Right.
We'll see what happens.
Should help considering they weren't doing anything, so yes.
Danielle, I reminded them that we had, back in the day, developed a interlocal agreement or some sort of memorandum of understanding, and we wanna revisit that.
Yeah.
Again.
And we'll have to modify that. So that original memorandum was dealing with ARP dollars, and we had to show that the project was going to
Correct.
move forward. So in a way, that part of it's almost moot at this point because the ARP dollars are gone, but we'll have to do,
I figured
an interlocal or
it's gonna start
something.
over.
yeah.
Yeah.
But it was more of me reminding the new superintendent that we need to get all parties to agree on paper to the concept.
And I think that's, well, and yes, and going forward as far as what happens after it's all done and
Right.
the decommission and who they're turning it over to and the
Yeah.
whole nine needs to be in that memorandum of understanding so that we have it laid out, who's picking up what rights and responsibilities when this project's completed.
We talked about that, the plan remains unchanged. You guys will take ownership of the infrastructure and maintain it. They
Yeah.
would be a customer of the district. And you would enter into an agreement with Gaston in a similar fashion to what you have with Yorktown and MSD and Chesapeake.
Correct.
That has not changed. There's a school board meeting on the
23rd of November,
of
October, excuse me.
October.
Yeah,
that Jason and I
I'll
will
be,
attend. Are you coming?
I'm gonna try, assuming I get back to
and
Maine.
he said you were out, Jason got a hold of me and I've committed to that. He's given me the date. I put it in my
Yeah.
calendar. I can be there as well.
Yeah.
So I'll make it work on my end, and it's more of just
Yeah.
an informational discussion with that board.
Right.
Again, re-educate that board
Yeah,
and get them all nodded at.
so, but it felt good. The superintendent feels like, and he seems to be want to be very transparent with the board. The board seems to be very open to wanting to get the project done and getting the infrastructure, and he seems to recognize that they're an educational institution and
Not a
has,
treatment plant facility.
and has no desire to be involved in running a treatment plan
Do we
and/or
know-
looking to be involved in economic development.
Do we know if that conversation has taken place with IDEM and straightened out all this reporting where we were tied into this? I don't know. I'm not trying to muddy the water. I just wanted to
They
ask.
they have a contract operator that they retain,
Yeah.
and I believe that they're separate, open dialogue with IDM. Specifically because they're now doing,
Yeah.
the on-site rehab work, so they need to keep IDM abreast of their activities. They likely had to provide some sort of compliance plan or some sort of schedule to show that they were taking the steps necessary. I haven't heard any different. It would be easy enough for me to hop on the virtual file cabinet and see what recent communication has been exchanged, but I would be very surprised if they're not working hand in hand with the local IDM inspector as they do some of this stuff.
that
That's
still
what he
Andy?
mentioned. He updated that about a month personally.
Yeah,
Andy did.
I mean,
Well, and the reason I asked that is stating the deal with Jim McGough when we were talking about about the finance company, and there's still some money left on the table that he can use or not use. I mean, I would like to have the IDEM relationship patched up with Westdale so that we could ask for that money as well. I mean, IDEM or Westdale should want that done.
I agree. And I think that they're going down that path.
Okay.
I don't have any reason to believe that they're not.
Okay.
Again, the folks down at SRF still believe this is a good project, they want to help, but they're not gonna do anything until they see that there's some skin. We're gonna be in a position to show them that come next spring.
I got a question.
Yes, ma'am.
Have we been able to get the paperwork that was taken back? Missing paperwork?
As
What?
Westel,
Yeah.
I don't know.
Has that been returned?
I don't know the answer to that.
I don't know.
So I think the most recent superintendent
Oh, yeah.
had taken some of the documents from
Documents
his
were-
time period from what was disclosed to us, but I'm not sure.
I did drop off a copy of
PER. Brenda, the short answer is the superintendent indicated to us that he did not have a lot of documents in his office when he got there.
Exactly.
And
So
will,
still
I
right there.
understand.
but I mean, that's between the two superintendents.
That's between the attorneys now.
Yeah.
Well, but it
that's-
was, part of it was, had to do with this deal we're talking about.
It was 5 years. My understanding was it was almost 5 years of documents that were missing. So yes, it pertained to a lot of it just disappeared. But that's not our cup of
That's
tea.
not
That's
our-
not our
that's not ours.
responsibility. But it will make a difference to IDEM
Will
if they don't
make a
get.
difference to them,
Yes, it will.
exactly.
I agree.
Yeah.
Anything else, Pete?
No, other, yeah, thank you later.
Okay. Commonwealth, Rob, you have anything, sir?
The bracking project, like Jason said, we're in our warranty period now. You know, I guess if you hear anything or get wind from our farmer friend, that anything was left hanging, make sure you let me know. so
I will.
can get it taken
I haven't
care
heard
of.
anything. So.
Okay. The Kamak project, the contractual work is complete, we're putting together a punch list to get that closed out next month. He gave you the update on that. I wasn't here last month, you guys got the information that I sent over when we checked the Watson's stuff, is that all?
No, I think we're just waiting on them.
I haven't heard anything.
That was going to be. I had a question. That was one where we were at with
We got
Watson's.
what we needed and verified what needed to be verified.
Go ahead and gift it.
I'll touch base with
So we
Dan.
ha-
My
they haven't
understanding is
gifted
they were
it?
preparing it, so I'll
Okay.
touch base with
That's
Dan.
why I wondered if
Yep.
it had been sent to us yet or
Mhm.
not.
We got the
Okay.
CAD drawings and we're able to verify that it has to be.
Cool. So it's still open as of right now.
Those are the.
I got one more. We did the CD this past month, and we were right at the line of 4%. If you guys, I'd like to have you guys like. I'm assuming the plans to continue to roll, but if we can get like another figure of what that percent looks like, 3.5, as long as we stay above that.
And what's our other option?
No, I think it's a great option to keep doing it. I just want to
Still
make
making
sure.
more money than leaving it in the
threshold
bank.
is-
Yeah,
We
I
have
mean,
no
that's-
reason for what we're setting on.
Yeah,
So.
I mean, I think that's my comment.
So
is-
could I get a motion to continue to roll
Yeah,
with the
so
CDs until we're down to, Jason notifies us at 3.5 or lower?
Yeah,
Yeah,
I
thank
mean,
you.
I think just keep us advised.
So do I hear a first?
Yes.
Do I hear a second?
Yes.
I have a first and a second. Any discussion? All in favor say aye.
Aye.
Opposed? Approved. Okay, that brings me to the end of this. Does any board member have anything else that needs to be brought forth today?
When are we starting budget meetings?
I got this, and I mean, health insurance is the biggest one. I've reached out to Yorktown, and I'll get with Chesterfield and verify treatment rates for the coming year. Then we'll be plucking away at it. I mean, yeah,
Sounds good.
Okay.
I got a feeling we could, depending on where, as long as I get back some rates fairly quick, and we could be having something as early as the end of this month, and possibly.
Take care of it in November.
Sounds good.
Any other questions? Seeing none. Public, anybody who would like to address the board? Yes, sir. Please step up to the podium, name, where, address, and please.
Board members, good afternoon. My name is Ronald Collins. I live in, not at the address I'm speaking to, but I'll give it that anyway, 4005 West Heath Drive in Muncie. but I'm here on behalf of my brother, David Collins, who lives at 1401 East State Road 28, and which is a part of your district. And what I'm here for is looking at options for billing conservation. My brother is currently dealing with some health issues and has been in and out of the emergency room and rehab since the end of July, and is currently not living at home. And I'm in a way trying to conserve. I take care of most of his financial affairs. He had a stroke 3 years ago and able to do much, but he is, because of his Medicaid waiver, able to live at home with the benefit of caregivers that come to his house. But right now, with the condition he's in and unable to walk, that doesn't really help him at all. He can't come home right this moment. So what I've been doing with his finances is trying to find a way to conserve his money because of the rehab costs. And I've done several things. You was not first on my list. I've done the suspension of his trash services. I've done suspension of TV and phone. I've reduced his cell plan by $45 a month, but so he could still keep a cell phone, but he was paying way too much. I reduced his mowing to as needed instead of weekly. I've also turned off his furnace for now. That won't last for long, but I'm trying to conserve there. Unplugged the softener, and also he's on a well in that area, so I've actually shut the valve off so that the pump won't kick on in case there's anything leaking, or just doing everything I can to make sure that the cost that he has, I can conserve as much as I can. But then the next step on my list, after I've gone through that list, is sewer. Paying $75 a month when you're not living there is an issue I'd like to talk to you about. And I've talked with Jason, and we've spoke, and he knows my brother well from other activities prior to when I took over. He had some issues, I know, but I've got those fixed, and hopefully his account has been in good standing for several years. But after talking to him, he said there's really no, what I want to tell you, voluntary shut off. The only thing he said that he recommended is I'd have to let it go dormant for 2 months, which is 2 months of payments, and another 10-day letter before you could legally go shut stuff off. So I'm asking, is there, I don't expect an answer today. I just come to present a case, and Jason gracefully let me come and speak about this, and we have. But if there's anything, two that come to my mind is just allowing it to be suspended like the other people have allowed me to do on his other bills, knowing that I'm in charge. I've got the stuff to come off. I've come to you and I spoke to you about what I'm trying to do. And if he's ever able to come home, then I'll say, hey, I've turned the valve back on and water's starting to flow again. I know without a water meter, you can't find out that I'm cheating, or somebody would be cheating. But I'm telling you that I've done all this stuff already, and everybody else has listened to me. But I also understand you have rules and regulations that govern your board. The other one is just a voluntary shut off, where I ask you to please go shut it off and suspend billing during the time that he's in the hospital and rehab. Or I'm open to any other discussions because I have done beyond that. I do want to say I didn't come here expecting an answer, just to present a case here, and it's a unique situation. I often think about what people do. Some of your customers surely go to Florida for 6 months, and I'm guessing they're paying their sewage for 6 months while they're in Florida with no water running. But anyway, like I said, I appreciate the opportunity to come and speak and present my brother's situation and what my mission is for him. And if you have specific questions, I can try to address, or I would do that at this point.
Jason, is there a fee for a voluntary shut off?
We don't have a voluntary shut off like ordinance written. So,
That's what I wondered.
Mr. Collins' brother, we got to the point where he had owed quite a bit of money. The property was disconnected.
Oh.
due to his health concerns and his health issues, we were having a hard time collecting on quite a few couple $100.
So it's already shut off?
No,
Oh, okay.
but Mr. Collins was helped us out tremendously.
I was not involved at that time.
No. His brother's the reason we were able to recoup that money. So that property in the past has been shut off. There's a valve in place, and you're currently on ACH, correct? Or you pay monthly with a check?
Oh, no, ACH.
Yeah. So since
So-
he took over his affairs, he's allowed us to withdraw it from the account, making sure it's always paid. We've had zero issues for probably the last 2 years since he's been handling that. Other than that, we don't have a ordinance in place, but I told him that he was more than welcome to come to the board and express his concerns and go from there.
I'll open it up to the board at this time for discussion.
I think it's an extraordinary circumstance. and
I do too.
$75 is a lot of money out of a miniature budget.
I appreciate the proactiveness. I'm gonna
I
gonna be blunt about that. That's
Yeah.
not what we typically get,
No,
right?
it's
So
I
So
don't
this
see
is,
that very often, that
Yeah.
a family goes to bat for another
Yeah.
person.
Yeah.
I think we ought to do it, let him turn it off for now, and since there's at least since there's already a valve in place.
well, I appreciate that, Brenda. I think we got to come up with a policy because
Yeah.
I think we
Absolutely.
need to be more we need to be more broader. We need to think
Yes.
about how this is going to affect the entire district.
Yeah.
I don't think we can handle this as
Well, you gotta
a
start
case by
somewhere.
case basis. So
Yeah.
whatever we do here, it's got to set the precedence, and so we need
Exactly.
to come up with something. And
Well, it'd have to be similar circumstances.
absolutely,
to
yeah.
this.
So
Just can't do it, haphazard and randomly.
right.
Well, like you
Uh,
said, going to Florida for
right.
6 months and use like that.
Right,
Yeah.
right, and
It's a hardship case, for
That's,
sure.
I think that's where I was getting is what if we ask the attorney to draft us a policy on hardship due to certain circumstances? We can kick this around for another month.
Yeah.
Going back and forth in emails because there is certain situation. This isn't if you were going to Florida for 6 months, you
Right.
don't. If you're in the hospital, if something's taking a
Right.
major surgery, you're in rehab for 6 months.
Yeah.
We have an elderly population that has to address certain things that are on fixed income. I think this is an area we haven't addressed, but it is one
Yeah.
that I'm open to address.
Yeah.
And I'm with you, Brenda. There's a shut off in place. Seeing that, we know there's no way it could be shut off and it won't be open until the phone call's made that his brother's back in and ready to go. So I'm good with your suggestion as well.
Yeah.
I think that's the best choice for now, and then Danielle develop a policy that follows along with what we're doing for them.
Yeah.
Is
some
that,
criteria
is that a
as to
motion?
that.
Yes, sir, absolutely.
I'll second that.
That is I have a motion, a first and a second to go ahead and do the shut off now and as a hardship, and Danielle will draft a policy that will be kicked around amongst us between the next month, so we'll have it for the November meeting that we can start to put in.
Yeah,
Absolutely.
and I would make a second motion that we just go ahead and make it retroactive for Mr. Collins once we do it, or to pause his, since we're going to do something, let's go ahead and pause his billing.
Okay, I've got two motions. I got a first and a
What?
second. I've got the first.
So let's vote on the first
Let
one.
me go
so
to
that
the
we
first
can-
one, which is.
Let's do that. I
Wait,
apologize.
okay, I'm gonna jump in. I
Okay,
think
yeah,
that was
my-
your
my
motion.
fault.
Yeah.
Yeah, I'll retract my motion.
Yeah,
so
that
we get
was
back.
hers because she
Yeah.
did say go ahead and move forward with it now, shut it, and go through the policy, and then we'll get it to.
Yeah, we'll do the policy. So the first motion is to do to have Danielle create a policy for hardships
Based on what we're
based-
doing for this gentleman.
based on hardships for
Yes.
medical and or whatever, medical, rehabilitation, anything else. And then I think we come back and we can do something retroactive for Mr. Collins here on this particular one, since we know we're gonna
This
go
is
to
not
that
living there.
Right.
situation. Does that make sense?
Yep.
Okay.
Okay, I've got a first and I've got a second. Okay, is there any further discussion on that? Seeing none, all in favor, say aye.
Aye.
Aye, oppose? Motion's approved.
Yeah.
Now, do you want to come back?
I would just make a motion that we go ahead and make since we know we're gonna do it, to make a motion that we go ahead and, pause. Mr. Collins's bill at this time.
Shut off the tap and move
Shut
it.
off the tap, hold the bill, knowing that we're going to do something
The November meeting.
until the November meeting, revisit it November, and make sure that it qualifies and go from there.
Jason, has he already paid for,
Yeah, he's, the fares are, yeah, they're completely paid in full right now.
so we got a refund?
No, I have not paid for October.
Hang on, I've got a motion on the table. I haven't got a second yet.
I second.
Thank
Okay,
you.
now I've got a second on the table. Go right.
Sorry. I thought the billing for October, we're at October 1st, so the billing for October doesn't come until the middle of the month.
Yeah,
So he hasn't paid for October yet.
I mean,
So
I'm good for
Yeah.
wherever
So
we're at in the billing
if you just-
cycle.
if
Let's
you
just
pause
go ahead
it,
and pause it.
And you just have to take him off of ACH.
we can handle that. We can pause the ACH.
Yeah, that's what I'm saying.
Yeah. Well, and the way our ACH works, it's only gonna pull what's due. So if we disable the account, you're gonna have zero, and it's not gonna pull anything.
Okay,
anyhow.
not an issue. I mean, I can cover the $75 this month. It's not a big deal. I mean, I'm just,
I really appreciate your proactiveness, right? The fact that
I'm
you've
trying.
been doing this, the fact that you helped us get it covered prior to that and everything else. I mean, you know, I'm good with it. I think we're headed in the right direction. It's something we're gonna do. I'm good with making the motion. Obviously, if we all come back and we're all fighting about it, we're gonna have to contact you and say we couldn't come to an agreement. So
I
we might
understand.
turn it
I
back
yeah, I
on.
understand. But,
So,
Jason,
I
I'm
don't
on
think we're gonna
Jason's,
do that, but
I have Jason has my number.
yeah, yeah. So I mean, I think I would just
But,
make the motion, we just turn it off and, go from there. So, but at least that's where I feel.
I'd like to make a revision to your motion.
Yeah, go ahead. I'm open to all of this.
I agree with shutting it off for now, but as far as suspending all of it, have it suspended for now, but since there's a lot of criteria we have to come up with, because I am for this. I understand the predicament.
No, I
and
did not
everything.
come, I did not come here for an answer
I
today.
don't want
okay.
other
It's okay.
people trying to abuse a system
Right.
because there are truly people in need. And so we need to come up with the right thing before we just say a blanket in this case. But I think it should be, how do I say it, make a motion that this is turned off for now. We have Danielle write up a ordinance, a policy, whatever you want to call it, so other people don't try to abuse the system.
Yeah.
In other words, we'll suspend for October. By November, there may be some different guidelines or standards. Once we have the time to go through and set the criteria, and we may come
Yeah,
back to you.
No, I'm absolutely on board.
So,
I-
so please be a
Yeah.
participant in the November meeting, or you can watch it online, however you feel best, sir. But
I
we
don't-
will address it in the November meeting.
It'll be fine to come here.
Okay.
I'm
Right.
sorry you're going through this as
Yes,
well.
yeah.
Well, thank you.
Sorry for that.
Yeah, I'm,
Yes.
Okay, I've got a first and a second on the table. Is there any more discussion? Seeing none, all in favor say aye.
aye.
Aye. Oppose? Motion is approved. Thank you, sir.
Thank you.
Anybody else? Dan, do you have anything for the board?
That's good.
I've seen nothing there, so we know where we're at. I would entertain a motion.
So moved.
A second?
Yes.
All in favor?
Aye.
Aye. We are adjourned.
Hey, Joe. Throw me your hand.